Hello, my name is Eric David Nampesia. I'm a son of my mother, Cecilia Nampesia. We are from Tanzania, East Africa. My mother was diagnosed with a severe aortic stenosis in the end of February this year when she was admitted at Aga Khan Hospital in Dar es Salaam. After that, we started looking how to solve this problem. That's when we met one guy, Shantia, who is based in Dar es Salaam. In collaboration with Dr. Mvungi at Aga Khan Hospital, they connected us with the Kim's Hospital here in India. So we started communication concerning how we could take our mother from Tanzania to Hyderabad for surgery, major surgery, for valve replacement. So it took us some days with the starting of finding a passport and a visa and other important documents in the means to come this way. By that time, we are discussing with some laboratory matters in order to take those documents here in India for doctors who are here at Kim's Hospital to know exactly what is the problem and how they are going to solve it. When they told us that aortic stenosis issue is within their control, so they say, now you can come. We can solve this. Even if it's a 2-valve, they are ready to solve it. Because Kim's Hospital, they told us it's a major hospital. They have more technical capability and different doctors who are able to do this operation. So when everything was sorted out, we got a ticket, and Kim's Hospital sent us an invitation. So we got, it helped us to get a visa and also passport for my mother and my wife, who escorted my mother coming this way. So we came to India on 6th of March by Etihad Airways from Dar es Salaam to Abu Dhabi, then Abu Dhabi to Hyderabad. We met Ahmed at airport here at Hyderabad with the ambulance. They took us straight to this hospital. We were admitted, and the first 1 week was to make her stable because her legs was swelling, and they started everything with a new procedure to make their test and the investigation to see exactly what the problem and how they're going to solve it. So first 1 week was to make her stable, and after that they did the echo and the angiogram test. After that, Dr. Nisarga, who is the chief cardiologist, chief surgeon, he talked to us and he told us how the operation will be done. That means surgery. He gave us whole picture, risk assessment, and to make us clear that this thing will be done. Everything is within their control. So there's no need for us to be worried. At the same time, I was communicating with my relatives in Tanzania just to give them full picture and to know exactly what will be done here at Kim's Hospital. So finally, on 16th, if I remember well, the operation was done here, and mother was admitted at ICU after 3 days from main surgery. So after 3 days, they took off from ICU. They brought her to normal ward. For all days, they have been collaborating very well with us to give us everything, feedback, any treatment they are provided to her, in order to give us chance also to inform my relatives in Tanzania. So honestly, we are happy with the services provided here. We're happy Dr. Nisarga with his team, Dr. Reddy Pratap, who is chief anesthetic here at Kim's Hospital. Also Rajesh Kumar and Avish, many doctors, we have the Indian names, but also with a team of sisters and nurses here. We are happy with the service provided. because the aortic stenosis was a life-threatening case. So finally, my mother, she is well. At least we are happy. We know what will be telling my relative in Tanzania. And we are going to be ambassadors to inform people about a heart cardiologist special services provided by Kim's Hospital. Otherwise, we are happy for everything. Thank you very much.
Hello. My name is Cecilia N from Tanzania, East Africa. I can't remember when I arrived here, but all relatives here in India, they took us to the ward and they helped us. Exactly. Dr. Nisarga said that the work was good, so he will help us. And now Mr. Nisarga has discharged us that we are okay. And I agree, I am okay. I thank very much for Dr. Nisarga and with his teams. They were good and kind to us. Thank you.
Yeah, this patient, Mrs. Cecilia, from far-off country, African country, Tanzania, they had sent a few reports earlier to me saying that this patient is very sick, not able to get operated anywhere else and rejected by many other hospitals, came to me, and when I saw the reports, it was looking very bad because her heart condition was very poor. Her heart beating was very poor, her contraction was poor, and she had 2 double valve disease. Her heart was damaged because of these 2 valves. The aortic valve and the mitral valve both were damaged to an extent that the heart was weakened. And she is 80-year-old lady, not able to walk, not able to breathe properly, not able to lie down flat on bed. She has sent all the reports. I went through all the reports. Initially I thought, let me see her personally, then investigate and see whether she is fit for surgery or not. She came to India with her son and daughter-in-law. Then we investigated her. We did angiogram. The cardiology team led by Dr. Ravi Kumar took care of her initially to treat her cardiac failure. She came in the ambulance from airport to the hospital. Then we admitted her. Then we did investigations. Then we started treatment for cardiac failure. She was not able to walk. She was not able to lie down flat in the hospital. Then with medication for about 10 to 15 days, she came to a shape where we thought, okay, now is the time where we can plan for cardiac surgery. We explained all the risk factors because of age and because of 2 valvular disease and the poor heart condition. Then they accepted the risk because even otherwise she cannot go back to her country without getting treatment, proper treatment. So we thought, okay, we'll go for surgery. Then we prepared her. One fine day, we did the surgery. We did the transesophageal cardiography, found that it was a single valve, aortic valve, which was really bad, and the other valve, mitral valve, was not so significantly bad. So we thought we'll go ahead with aortic valve replacement. We did aortic valve replacement. After surgery, she did very well, and in the ICU she stayed for about 2 days. After 2 days, we could able to shift her to ward, and her post-operative course was very nice. About 3rd day she started walking. Then 4th day she started climbing stairs. Now she is in the ward and getting discharged today. She is very happy to go back to her own country with all smiles on her face, and son is also very happy, and she is fit and fine now. She is able to climb stairs nicely without any trouble, and she is able to live long further. It's a big teamwork which has really given this success. Although I am a chief cardiac surgeon here, the cardiology team led by Dr. Ravi Kumar and anesthesia team, especially ICU and anesthesia team, led by Dr. Pratap Reddy, and all other people who have worked for this patient gave a very good result. We were really worried about the calcium load inside the aortic valve, which was a high risk factor for her, because even a small bit of calcium, if it goes to the brain, it can cause severe stroke. So the calcium load was so much, and we had to take out all the calcium from the aortic valve very meticulously, so that she will not have any stroke further during or after surgery. And she could come out without any such bad complications. Thank you.